This morning, we'll be speaking with Bridget Hollingsworth-Stafford from HAP, and we'll also shine our Guaranteed Rate Business Spotlight on Dr. Garner from Bain Solutions. For those of you who haven't listened to our show before, Bridget is the Director of Marketing and Community Outreach for HAP in their Mid-Michigan market. Hi, Bridget.
Good morning. How are you, Tracy?
Good morning. How are you?
Awesome.
So what do you want to talk about today?
You know, it's officially summer, and a lot of us have been itching to get out of the house, and if that sounds good to you, you're not alone. So we're going to talk about some summer safety tips.
Awesome. So what is the number one thing you can think of that would be the biggest tip if nobody hears anything else today? What should they hear?
Just, think about what you're doing and think about what you need to do to protect your family. There's so many different things in the summer. And, right now the hospitals and urgent care centers, they're getting ready for what they call trauma season. So that's not really good. It's emergency rooms.
No, that's
not good. They actually see about twice the number of injuries and traumas in the summer compared to the winter because we're out doing all kinds of crazy stuff. Some of the most common injuries, they're car crashes, sunburn, which can be very serious, water sports injuries, dehydration is huge in the summer, heat exhaustion, and falls. And, COVID-19 isn't quite over yet, and there's still some concerns there.
Yeah, keep social distancing with people you don't know.
Yeah.
That's a big one, right?
Exactly.
Right.
And, kind of deciding what you're comfortable with is a little bit different for each of us. And we want people to understand that there's still some ways that they can stay safe. And one of the ways to lower the risk of COVID-19, especially in the summer, I guess you could steer clear of peak times at the beach or pool, maybe go early in the morning or late. And you're right, keeping 6 feet of distance is still important. And know that if you can't do that safely, you might want to rethink it's especially if COVID-19 is certainly a concern for you. In most other places, you can still wear a mask if you want to. That is not required, but certainly if you're at risk, it's not a bad idea to wear a mask. Of course, keep washing your hands, which I don't know why people should do that anyway, right?
Exactly.
And again, social distancing is still a good idea.
Yeah, just because the restrictions have come off doesn't mean that if you feel like you need to wear a mask or you want a social distance that you can't still do that. It just means the government's not telling you to do it. Right?
It's not a requirement. No, I've talked to a lot of people who said, I'm going to keep wearing the mask because guess what? I usually get 4 or 5 colds. I haven't gotten a single cold. So people are, so don't feel bad about it. If you feel more comfortable wearing a mask, do it. There's no reason not to.
Yeah, the COVID has been really hard on the up close people.
I know, it really has.
The big huggers.
I am seeing hugging coming back a little bit though. So we'll see
I've been grabbed a few times and hugged the last week.
Yeah.
It's all right, but I'm not a huge hugger, so it didn't bother me at all with the COVID. And I see a lot of the handshaking coming back, but
So just be aware.
And if you're not comfortable with that, just let people know, hey, I'm not comfortable. People aren't going to care.
Right.
They understand.
Exactly.
They understand.
For sure.
So, so that's the COVID part.
Yeah.
Let's get on to regular life.
Summer
what else
stuff,
is there?
Exactly. And we've talked about this before when we talked about how important water is. But honestly, dehydration is a risk for a lot of people, and water is your best choice. So don't wait until you're thirsty. Drink a lot of water during your activities, especially if it's hot. And so you want to, kind of moderate your alcohol use. Maybe alternate your alcoholic beverages with water is a good idea. Also, kind of take it easy on caffeine. And another great way to get additional water into your diet is to eat lots of fruits and vegetables, especially those that have a high water content. And a couple of those, watermelon is great for that. Have you ever heard a watermelon would be like the size of a baseball if it didn't have water? That's just a fun fact. Yeah.
Wow.
I know.
That's interesting.
Yeah.
And celery is kind of the same way. Celery is pretty much more water.
All water.
It takes more calories to eat it than
I've heard that. Yeah,
that's kind of weird.
Strawberries are good. Grapefruit, peaches, which we'll start to see some fresh peaches here pretty soon, I think. Eggplant and spinach are also a couple of really good choices too.
Really?
Yeah.
I wouldn't have thought about spinach, but watermelon definitely. I mean,
for sure.
It's in the name. Come
right.
on.
Well, maybe that's probably where they came up with it.
Speaking of dehydration, my husband and I went out west a few years ago, and we went hiking, and we're like, we're just going to run down this little patch here and come back to the car. And we got down there, and we're like, hey, let's keep going. Did not think about the fact we did not pack our extra water. I'm telling you, we got done. We had walked 6 miles.
Oh my gosh.
Which was not good. We weren't even thinking, and on our way back up, it wasn't so bad going down, going down 400 feet. But coming back up the 400 feet, it was like, oh, crap. I don't have any water, and this is not good. So make sure you have water.
Yes. There's never really any time that you shouldn't have a water bottle nearby. Sometimes my car gets a little junky because I have a little secret drawer in the back of my car, and I always have a couple bottles of water in there. But do try to keep it with you at all times. It's super important. Another thing that we forget about, but we really need to focus on, is wearing sunscreen. You want to use a high SPF. You want to protect against sunscreen, and you do need to reapply that sunscreen often, especially if you're out sweating like you were probably on your hike, or if you're in the water. You might actually, especially if you're susceptible to sunburn, you might want to just look at staying in the shade between like about 11 and 4, just because that is when the rays are the strongest. You have the greatest opportunity to get burned. And keep your kids in the shade as much as you can, and wear hats, cover your skin. They have lots of new things. You see a lot of kids' bathing suits these days that actually have long sleeves and stuff, and that's just one less thing to worry about, So do take the sun seriously.
Yeah, and they have those sunscreens, which I love, that at least when my kids were little, and they're old now, but when they were little, they had just started coming out with either the spray-on sunblock or the kind that the lotion that was a different color when you were putting it on, so you could see if you missed any spots on your kid. So, especially children, because they can burn so easy.
For sure. And you do need to remember to reapply that. Once is not enough when it comes to sunscreen if you're going to be out for a while. So please take that seriously. And remember back in the day, we used to slather up in baby oil and stuff. Don't do that.
You know what? I never did that. I remember though my mom doing that, of going outside and putting baby oil on her legs. I remember her doing that. We're talking back early 70s and stuff like that. Nobody was thinking about sun or what do you call it, cancer, skin cancer or anything like that. Nobody was thinking about that. But I remember finally she stopped doing that. I only remember her doing it a couple times. Maybe she was like, this is silly. I don't know. But, don't do that.
Right. Don't do that. Don't do that.
Don't use butter.
No butter.
No
either.
butter
no
either.
Butter.
Yeah,
no. That's not a good idea. And
you're not the Thanksgiving turkey.
Exactly. Butter you up. No, but do use some sunscreen, and also think about planning when you're actually going to be physically active. If you have a choice, try to limit the activity when it's super hot midday. That will help to reduce your risk of heat exhaustion or heat stroke. And you might want to kind of get used to hot weather. By slowly increasing the amount of time, and sometimes going from air conditioning to outside and so forth can be kind of, difficult to manage.
Yeah, and I think that's why you'll see a lot of people out working in their gardens or their flower beds early in the morning or late in the afternoon, because those are the better times. You're not hitting the peak heat. And plus, even for your plants, it's better to water them early morning and late afternoon, because then the water has time to get off the leaves, because you don't want the water in the leaves during the peak of the day, because then you can burn the leaves.
Yep, crazy stuff. And, I mentioned that, water sports and injuries and problems around water are a huge concern in the summertime. And so back in your day, you remember at summer camp when they would say, buddy check.
Yeah.
It is really important to have a buddy when you're engaging in water sports, so you can keep an eye on on one another, check on one another. And if you're at a situation, a beach or a pool where there's a lifeguard, please follow what they tell you to do. I mean, they are there for your safety and to make sure that there aren't any problems. And honestly, if you've got kids, you've got to make sure that an adult is supervising anytime they're around water, whether it's a lake, a pond, a pool, even a small little kiddie pool can be dangerous. So you've got to really watch your kids closely. And also, take it easy on the alcoholic beverages if you're going to swim or be out in the water. Really, it's oftentimes it's a big risk.
Right. No partying on the boat.
Yeah, take it easy, people. Take it easy. And yeah, traveling, is a lot of us are traveling, holiday weekends, lots of fun summertime. You want to make sure that you don't have any trouble with your road trip. So another idea is to keep your car, make sure you've done all your upkeep, your oil changes, your tires are safe and all that sort of stuff. And also make sure that you give yourself plenty of time to get where you're going so you don't have to deal with, a lot of extra traffic, which increases the risk as well. And if you can travel during off-peak hours, it's a lot more pleasant, I can tell you that.
Yeah.
And still, COVID-19 is still a concern. So try to limit your stops at public restrooms. You might want to have some disinfectant wipes and snacks available to you in the car. And if you're going to be staying with friends or family, talk about it together. Talk about what you're comfortable with. Talk about limiting your exposure ahead of your visit. COVID is really not 100% gone, and it may be a continued part of our life for quite a long time. So you do want to keep that in mind. Make sure everyone's comfortable with the protocols. So if you find yourself with a minor injury or an illness, it's always a good idea to contact your primary care physician if it's a minor situation. Always, if it's life-threatening, you're gushing blood or you have chest pains, those sorts of things, don't call anybody, but either 911 or get to the nearest emergency room. But if it's just a minor thing, your doc can help.
Bridget and I are not doctors, but you know what? If you're gushing blood, call 911.
Right, don't call me. Don't call me. Your doctor. Right.
Exactly.
So it happens, and people don't know what to do. Honestly,
and they call their parents or something like that. It's like you get that call. My arm is hanging off, and what do I do? I'm like, why are you calling me? Call 911.
Yeah. So, and I think people are always afraid of that. But most every insurance company, HAP included, will cover a true emergency. So if you're truly in a dire situation, don't worry about it. Just go and get the care that you need. Take care of your family. It's going to work out.
Right.
We're here to help. We're happy to provide information. We're happy to support our members in the community, and we're well versed in wellness, as we've discussed over time.
Right.
So if you need more info about HAP, please feel free to visit our website at hap.org.
All right. Awesome. As always, Bridget always brings us the best information
be safe,
for your
have
families.
Fun, and don't forget, fireworks are a huge risk too. Please be careful. I would love it if you just watched them and didn't try to shoot them off yourself.
Yeah. If you have kids, just be careful. Make sure you're following whatever the instructions are that you received for space limitations, that kind of stuff. So we just ask everybody to be careful and be safe on this 4th of July.
Keep things in moderation. Have a great time.
Yeah, exactly. Well, it was so nice having you here again today.
Great to be here, Tracy. Thank you.
Again, it's hap.org, right?
That's correct. Hap.org. You can get lots of great info.
Yeah, and I would remind that HAP, Shea Automotive Group, Financial Plus Credit Union, and Flint Township Development Authorities are all our sponsors, helping bring this information to our listeners every week. So
we're so happy to do it.
Yeah, we're happy to have you as a part of it. Thanks. Have a great day.
You too. Thank you.
During our Guaranteed Rate Business Spotlight segment every week, we will be featuring a Flint Township business. Today we have Dr. Scott Garner from the Vein Solutions. Welcome, Scott. How are you?
Hi, I'm fine. Thank you, Tracy.
Great. It's so nice to have you here. Now, what is your role at Vein Solutions?
Well, as you know, Vein Solutions is part of Michigan Vascular Center, and I know you had Dr. Mark Matos, my associate here last week.
We did.
And Michigan Vascular Center is a full vascular surgery group that provides all vascular surgery services, and part of vascular surgery is taking care of veins. So, Michigan Vascular Center, as you may have heard, but I'll repeat anyhow, started in 1963, and it is a group now of 10 vascular surgeons, and we provide all the services. And in about 2003, we broke off a separate office to just to take care of veins only, and that's where Vein Solutions came from, and that's when that started. And so I work out of the Vein Solutions office to care for patients with vein problems.
Okay, so that started in 2003 here in Flint Township, right? And so you said it's part of Michigan Vascular, so you're in the same location as Michigan Vascular. They're on the corner of Bristol and Linden Road, right?
Well, actually, yes, Michigan Vascular's main office is at Linden and Bristol Road.
Okay.
And that's where we used to do all the vein work up until 2003.
Okay.
And then we opened the office at Gateway Center, at the back of Gateway Center.
Oh, okay.
So off of Hill Road and US 23, kind of go back into the Gateway Center. There's Redwood Lodge, the Holiday Inn, Cortland. There's many hotels and other professional offices.
Right.
And so that's the office we opened in 2003.
Okay.
And that's where Vein Solutions is located.
Okay, so you're located there, and then you do work with Michigan Vascular all around the area, right?
Correct,
okay, yes. All right. So now, is this a specialization for one surgeon, or do you have more than one surgeon there at the Vein Solutions? How does that work?
Again, as to the broader point, Michigan Vascular takes care of all vascular problems, which includes vein problems.
Okay.
But however, I took a great interest in vein care even in the 90s. I came to town back in 1993, and so I took an interest in vein care. And in 2003, the group opened the office, and then I've been the only doctor that has been working on veins for the group of, again, for the whole group of Michigan Vascular Center. However, my other partners and associates are more than capable of doing vein work, but they generally defer that work to me.
Okay, so that's your specialty then.
Yes, that's correct.
And so now, what are some of the vein problems in general versus arteries?
Yes, that's actually a very important distinction, and I think that needs to be made. As vascular surgeons, we work on blood vessels, and really in this most simplistic form, blood vessels are just pipes that carry the blood around the body, so it's really a plumbing issue. And Michigan Vascular Center, which focuses on the arterial problems, the arteries are the blood vessels that take the blood from the heart and take the blood out to the body. And that's the very important component of the circulation, because that is the blood that carries the oxygen that our body needs. Well, once the arteries deliver the blood out to anywhere in the body, our body uses the oxygen, and then it's the veins that returns the blood to the heart and the lungs, so the lungs can put more oxygen in the blood. And then the arteries take it out. So the blood just goes round and around. And the veins are the blood vessels that return the blood to the heart. So there is a distinction. Even though it's all part of the same system, they perform different purposes.
Yeah, so now you've got me thinking about plumbing. So I'm thinking, okay, the arteries are the copper taking the water out, and the veins are like the sewer line taking the blood.
Not quite the sewer line, but yes, taking the blood back.
It's not clean. It's not the pure blood. But no, my husband's a plumber, so that automatically came to my mind. So, but that's interesting because you never really think about that veins and arteries are different. You just think about that they're all taking blood around your body.
There's no question. They're part of the same system. They're doing the purpose is to carry the blood, mainly to deliver nutrition and oxygen to the body, but they work together, but they have different functions in that system. Right.
Okay. So then let's talk about medical versus cosmetic vein treatments. I know there's got to be a point where probably insurance companies say, no, that's cosmetic versus medical. Is there?
No, that is correct. And again, I'll back up just a bit, because really, vein problems are actually fairly common. Vein problems in the lower extremities of the legs are common. In fact, depending on what study you read, it's anywhere from 20 to 25% of people will have vein problems, and most of these vein problems actually are medical conditions. Now, the good news is that most vein problems are not a dangerous condition. They're mostly benign. Now, there are definitely when we talk blood clots, which is a topic for a whole nother show we won't want to get down, but that would be a dangerous condition. But most day in and out vein problems, which include varicose veins, lower leg achiness and discomfort, and leg swelling, are fall in the category of medical vein problems, and they are surprisingly common out in the general population.
Okay.
Then you have cosmetic conditions, which are more related to visual appearances, especially spider veins, which are smaller veins that run in the skin, which are also very common, and that would be more a cosmetic issue. So, but vein problems are actually surprisingly quite common out in the general public.
Yeah, I didn't think about that. That the spider veins, those are when you can see on their leg the little like tracks of veins. Coloration is
That's
what you're
correct.
seeing on
Yes,
the leg,
that's
right?
correct.
So that's more of a cosmetic condition, not
in most
risk,
circumstances. Yes,
most circumstances. But if it's bothering you, you should still get it checked out, right?
Correct.
Because again, I'm not a doctor, but Scott is. So,
Yes.
but so let's think. Now, before we get into any extra stuff, I want to bring up, now I'm sure you're available as needed, but do you have regular office hours?
Yes, our Vein Solutions office, like Michigan Vascular office, is open from 8 to 5 o'clock on all days. And we have regular office hours, and we'll see. Any patient can call and get an appointment. In fact, Vein Solutions does offer an initial free screening. Actually, if a patient is not really sure what they're dealing with, it's a very brief visit with me where I just take a look at the legs, and then we ascertain, one, is there a vein problem, and two, if it is a vein problem, if there's any medical implications, then we would discuss what the best way to go. And it's a very brief visit, and there's no charge for that visit.
Okay, so that brings me to my next question. So if somebody wants to get a hold of you, how would they get a hold of you?
They would actually can call my office, which is and we also have a web page that people that can use, like veinsolutions.com.
Okay.
Do you want me to give the phone number?
You can.
Okay. Well, I always worry I get the number wrong, but no,
that's all right. If you want to we can just direct them to your website.
No, it's the number is 810-232-3363, and also Michigan Vascular. If you call the Michigan Vascular office, they would direct you to Vein Solutions. Also.
Now, do they have to have a referral from their general physician to come to you for the free screening, or can they get the free screening?
No,
first?
patients can always come in and get the free screening. And then in terms of whether a patient would need a referral from their family doctor or primary care doctor is all dependent on their insurance. Some insurances require, some do not. If the insurance does not require that, then they would not need a referral.
And they can find that out when they get the screening done, right?
Correct.
Since it's free. So
Correct.
Okay. So I'm trying to think if there's anything we've missed. I can't think of anything that I've missed on the briefing I kind of had about your business, but is there anything that you would like to speak about in addition to what we've already done?
Well, no, I think I would just reiterate what Dr. Mattos said. I mean, Michigan Vascular Center has been a part of the community since 1963, and we serve all the hospitals in Genesee County, all three hospitals, and we also have office in Lapeer and also in Saginaw. So again, the purpose of Michigan Vascular Center is to provide comprehensive vascular care, and I'm just part of that puzzle, which is the venous care. And And so that's really what the whole purpose of the group has always been, to provide the best venous.
Yeah, they called it their
available.
comprehensive care strategy, I think is what they called it, where they do everything, where they can have the vein solutions, they have follow-up care in their offices.
When you look at vascular surgery, you really break down into arterial side of the problem, and there's many arterial problems. Again, you could have a show on every one of those problems if you'd like to.
Right.
And then you have, that's where the main office at Linden and Bruce Road is, and then Vein Solutions over at Gateway Centers, where we take care of all the venous problems, and there are other subspecialties that we work on. Mainly dialysis patients, people with renal failure. That's another service that we provide, because that's unfortunately a fairly needed service that needs to be.
Okay, so my producer just asked a question. He wanted to know, what is venous care?
Venous care, well, that's a very broad topic, but it involves venous problems generally involve the lower extremities of the legs.
Okay.
And probably the most common problem people get are achy, tired, throbbing legs with varicose veins. And that comes about because the veins in the lower extremities are not working. And as I said a while ago, it's a relatively common condition. And so that is our bread and butter, if you will. People come over and have us help their legs feel better. And one of the nice side effects, it can usually make the legs look better also.
So what do you do for spider veins? How is that treated?
You're kind of getting the cart ahead of the horse there, because one of the things that you want to do is you first have to evaluate the patient in terms of what's going on and do an evaluation, because that will help you decide what the best treatment is. But just in general, painting with a broad brush now, the most common way to treat spider veins is a treatment called sclerotherapy, where you inject medicine into the vein. The medicine damages the vein, and that helps the vein. More or less, the vein dissolves and goes away. So it helps the vein fade away.
What normally causes that? Because I've seen that, and it's usually on older women like myself, because I'm old.
No, don't be so hard on yourself now. Generally, it can happen actually as early as the teenage years, but generally it just comes from a dilatation of the small veins that run through the skin.
Okay. All right. Well, it doesn't sound like it's too bad of a treatment to get done. Seems like that. I mean, from what you said. Is it an outpatient treatment? No,
almost all of our patients are outpatient, mostly done in the office. They're fairly minimally invasive treatments now, so it's gotten much easier over the last 20 years caring for the veins, as opposed to the olden days when you'd have to go to the hospital and get a vein stripping and things like that. That's pretty much a historical footnote. That's not done anymore.
Yeah, it's amazing to me of all the outpatient care that's available nowadays. Things you don't think about, but years ago, I remember, I don't remember if it was my grandma, I think, had something done with her vein. She had to go to the hospital. It was like this whole ordeal. And I was like, oh, man, I never want to have that done.
Yeah.
But you don't have that nowadays. So.
No, yeah. Before 2000, that's what required. It required a hospitalization with general anesthetic. It was still outpatient surgery, but it was a minor operation, which is still an operation. And since 2000, it's a much simpler procedure where you essentially put an IV in the vein and you can just seal the vein closed under a local anesthetic. So it's a much, much less invasive way to go about it.
That's amazing. I all this medical stuff, I find it very interesting. I know when Dr. Matos was here, I was just like, I could listen to him talk all day. And the same way with you, I find all this just fascinating to hear just the jumps in technology and how it's changed, just like I said, just from the 70s and 80s to today.
Correct. Even the 90s, even from the 90s and the aughts, if you will.
Yeah. Yeah. Now, when you first started doing these, because you said you came here in 93, were you a doctor then in 93?
Yes, I was.
Okay.
Yes.
So, were you still doing surgeries at that time, or was it outpatient then?
No, actually, again, when I came to town, I came right out of my training, my residency and fellowship, and I joined Michigan Vascular Center, of course, which when I joined, there were 7 surgeons, and I became the 8th surgeon. And then, yes, in the 90s, we were doing surgery, going to the hospital, doing all the surgeries. And then, again, in 2003, I segued out of the major arterial work and have just done venous work since 2003.
And my producer is like flagging at me because I'm taking too long. So I got to wrap this up. But I want to thank you for coming in. I really appreciated having you here. And I think we're going to hear from another one of the doctors that's involved in Michigan Vascular in the next week or so. But I do want to thank you for coming. And if anybody wants to hear more about Vein Solutions, you can go to veinsolutions.com. And I would like to remind our listeners, you can email us at discoverflinttownship@gmail.com. Visit our Facebook at Flint Township Events. Our YouTube channel is Discover Flint Township, and so is our Anchor podcast channel is Discover Flint Township. You can visit us on our web pages at discoverflinttownship.com or flinttownship.org. And I want to thank our guests, Bridget and Dr. Garner, for coming in today. And thanks to our partners at HAP, Shea Automotive Group, Financial Plus Credit Union, Guaranteed Rate, and 103.9 The Fox. Discover Flint Township with us again next Sunday at 7:30 a.m. here on The Fox. This is Tracy Tucker, the Flint Township Economic Enhancement Director, and I would like to remind everyone to stay safe, stay healthy, shop local, buy local, and discover Flint Township. We'll see you later.
This has been Discover Flint Township with Tracy Tucker. For more information, visit discoverflinttownship.com. Flint Township is ready for your next move. The preceding program was pre-recorded and was paid for by Discover Flint Township. The views expressed are those of Discover Flint Township and do not necessarily reflect the views of 103.9 The Fox or Krill Communications, Inc.